Hello guys, welcome to Disaster Management Complete Syllabus Explanation Series Part 5. Social, psychological and psychiatric support. Children caught up in a major incident may need the supportive framework provided by social and psychological services in which they can come to terms with the effects of disaster on their lives. Not only does this rapidly get help to those who need it, but may also reduce long-term and chronic demands on health and social services. Management of individual situation. Diarrheal diseases. Acute diarrhea kills more children in emergencies than other types of diarrhea. Cholera and dysentery are more common. Diagnose, treat and control the spread. If ORS is not available, prepare homemade ORS. Ensure clean water supply, hygiene and sterilization. Proper hand washing and personal sanitation is most effective way of preventing dysentery transmission. Encourage breastfeeding. Management of diarrhea does not differ from routine cases except addition of antibiotics. Measles. It is most contagious disease. Overcrowding may increase its spread. Measles outbreak may still occur in spite of pre-disaster high vaccination coverage, as coverage and efficacy are not 100%. All children 6 months to 5 years should be immunized irrespective of their immunization status, preferably within first week. Good treatment should be provided to older children having fever with adequate fluid intake, continued feeding and vitamin A. After this vaccination is completed, provide regular immunization with measles and other EPI vaccines. This covers initial left-outs infants reaching 6 months and infants who received first dose between 6 to 9 months, get the second. Malaria. Young children and pregnant mothers are at increased risk. If there is malaria epidemic, patients with fever and malaise are to be treated with antimalarial, because laboratory diagnosis is not possible in the field. Curative treatment alone is not useful and enough in young children, as they may be infected. So stress is given to prophylactic and preventive measures also. Preventive measures include spraying insecticides from mosquitoes with chemical impregnated net or mosquito repellents and destroying breeding sites. Respiratory diseases. They are caused due to overcrowding, inadequate clothing and inappropriate shelter. They are managed with good supportive care, antipyretics and other minor health problems. Skin disease like scabies, impetigo and boils, lice, bedbugs. Eye diseases like trachoma and conjunctivitis. Worm infestation and protozoal infections. These all can be treated accordingly on OPD basis. Malnutrition. Causes. Inadequate dietary intake due to lack or poor variety of food, too few meals, food being too bulky and unfamiliar, lack of breastfeeding in infants, dependency of elders, etc. Diseases as mentioned reduce appetite and absorption, and increased metabolism increases the need of food. Lack of food preparation. Lack of childcare due to separation, and it is second priority after family problems, and lack of time in food preparation and feeding. Even elders and such vulnerable groups are not given priority over managing their family as a whole. Prevention. After assessing the overall nutritional status of the people, food distribution and supplementation is planned. Assessment. For assessment, weight for height is the most reliable way, and mid or circumference for under 5s. Look for pallor, signs of vitamin A deficiency, wasting and failure to guess weight. Treatment. Stabilization, diagnosis and treatment of complications like hypoglycemia, hypothermia, dehydration, infection, sepsis, etc. Other general measures be taken are deworming, measles immunization, vitamin A supplementation, continuing breastfeeding. Rehabilitation, high energy food is supplied with iron and micronutrition supplementation. Apart from this, physical and emotional aspects are also taken. Anemia. Anemia can be caused by malaria, worm infestation or malnutrition. Iron given in stabilization phase can reduce resistance to infection. Hence weight-giving iron preparation until proper weight gain. Along with iron, vitamin B complex and C are also given. Vitamin A. Deficiency of vitamin A further reduces immunity of a child. It is supplemented with foods having vitamin A and high doses of oral supplementation. The dose for 6 months child is 50,000 IU once only for 6 to 12 months child 1 lakh IU every 6 months and for above 1 year child 2 lakh IU every 6 months. Breastfeeding. It is very important source of nutrition for infants and young children. It avoids infection, prevents malnutrition and neither need fuel and water nor creates rubbish. Certain false beliefs like effect of emergency on ability to breastfeed are to be clarified and do not entertain inappropriate promotion of artificial feeding. Alternative like wet nursing, breast milk banks or artificial formulas are to be through for orphan and separated child. Mothers are helped in re-establishing breastfeeding. Motivation and support. Explain disadvantages of top feeding over breastfeeding. Reassure enough no milk and explain sucking reflex. Ensure enough fluid and food for mothers. Avoid dummies and typhoid. Typhoid is a very common disease in our country and is more so in disaster situation. Indian Academy of Pediatrics recommends routine use of typhoid vaccine but not as a message. Tetanus. Significant increases in tetanus have not occurred after natural disasters, and hence mass vaccination against tetanus is usually unnecessary. Emotional problems. The short-term emotional effects of disaster like fear, acute anxiety, emotional numbness and grief may also be obvious. For many victims these effects fade with time, but for many others, there may be long-term emotional effects, both obvious and stable. Some of the emotional effects are direct response to the trauma of disaster, while others are long-term response to interpersonal, social and economic effects of the disaster. In any case, in the absence of treatment more than half of the victims of a disaster may develop lasting depression, pervasive anxiety, post-traumatic stress disorder and other emotional disturbances. Even more than the physical effects of disaster, the emotional effects cause long-lasting suffering, disability and loss of income. Social dependency is another issue, where child often becomes heavily reliant on others for help. Involving them in their rehabilitation can prevent impacts including social disaster impacts. As noted earlier, disaster impacts comprise physical and social impacts. The physical impacts of disasters include causalities and property damage, both vary substantially across hazard agents. The physical impacts of a disaster are usually the most obvious, easily measured and first reported by the news media. Social impacts, which include psychosocial, demographic, economic and political impacts, can develop over a long period of time, and can be difficult to assess when they occur. Despite the difficulty in measuring these social impacts, it is nonetheless important to monitor them, and even to predict them if possible, because they can cause significant problems for a long-term functioning of specific types of households and businesses in an affected community. A better understanding of disasters' social impacts can provide a basics for impacts prediction and the development of contingency plans to prevent adverse consequences from occurring.